Hi friends, welcome back to my channel. Today I'm here with an OET case notes discussion. It is an important case note because here we are going to discuss about two patients at the same time. So let's see in detail how we can write it in a proper way. Okay. So first we are going to read the case note. Ryan and Rohan are patients in a newborn ICU where you are the NICU charge nurse at Royal Women's Hospital, Sydney. Mother is already discharged and babies are yet to be discharged. Age 1 week old babies. Address is given. Then mother's name is Mrs. Angelina Michael. Date of birth is given. Had gestational diabetes mellitus during antenatal period. Attended all antenatal visits. Then father's name is Michael Luke, 34 years and he is a graphic designer. Other children is Riona Michael, 2 years old. These are the information we got. Let's move on to the next. Next is given the medical history. Mrs. Michael's admission date is 8th January 2019. Complaint of fetal distress due to cord entanglement. Cesarean section done at midnight, the day of admission. Then patient 1 details. As I mentioned before, there are two patients here because these are twins. Ryan, 3 days old, the first baby, aspirated meconium, decreased heart rate, increased respiratory rate, bluish discoloration on upper and lower extremities. UPCAR score is 4 out of 10, poor sucking. So oxygen 2 liter per hour, weight 2.5 kg, fraternal twins, dizygotic. Diagnosis confirmed through chest x-ray and blood gas test. Then what's the medical progress? On 17th January 2019, still he has poor sucking. Then what are the nursing management? Prophylactic antibiotic therapy, ampicillin 50 mg BD, gentamicin 15 mg BD, radiant warmer therapy, IV fluid D5 normal saline, oxygen therapy via tent. These are the nursing management has done for this first baby who is Ryan. One more thing, CPAP, this continuous positive airway pressure for 3 days after delivery because he has POSAG and maybe there is breathing difficulties. Next we are going to say about the patient of second baby, that is Rohan. Same 3 days. Second baby weight 2 kg at the time of birth. Poor sucking. UPCAR 6 out of 10. Heart rate good but the respiratory rate is low. Both are expelled meconium. The diagnosis cleft lip and cleft palate. Mother is depressed because of this reason. Then what are the nursing management? Same like first baby. IV fluid dextrose normal saline therapy, oxygen therapy via tent, and radiant warmer therapy to continue till he gains weight. Then what are the general discharge plan? Rohan needs radiant warmer therapy, monitor sucking ability of both children, continue IV fluid therapy for both children. Rohan needs pediatric surgical consultation because he has this cleft lip and cleft palate. Then monitor their weight every day. Needs psychological support for their family, especially for the mother. As it is mentioned there, the mother is depressed due to his condition. So it's very clear and written well. It is easy to understand. So just to organize and write it in the proper way, which should be conveyed to the reader. The important part is coming, that is the writing task. We should get the full information from the writing task regarding the reader to whom we are going to write the letter. Using the information given in the case notes, write a referral letter to Miss Daniela Robertson, who is that newborn specialist nurse, Sydney Children's Hospital, Randwick, New South Wales, Australia. Inform her of the current situation, medical background of the newborn babies, and requesting an immediate management for both babies. So from this case note, we have got an idea what are the information we have to include in this letter and to whom we are going to write it and what is the purpose of this letter. So how we can write it? First we can write the address Miss Daniela Robertson, newborn specialist nurse, Sydney Children's Hospital, Australia. That's even though you didn't write Ranvik, it's okay. Then the date is 7th January 2019. Dear Miss Robertson, always we are using the surname. Then reference, we have to write Ryan and Rohan because we are going to refer both of them. Then let's write the date of birth, January 2019 because it is mentioned that is the admission date and they have done cesarean section at the same day. So how we can write the introduction? This letter is being written to refer Ryan and Rohan, high risk newborn babies, who have poor sucking as well as congenital abnormalities respectively. Then they require your immediate care and management after their discharge today. Then next para we can write Ryan and Rohan, a fraternal twins, were born through an emergency cesarean section due to meconium aspiration. Initially, they were treated with intravenous fluids, radiant warmer therapy, and oxygen therapies. Because they gave oxygen through tent and also CPAP, no? That's why oxygen therapies. Later on, both are expelled out meconium. However, still they have sucking difficulties. Next, we can talk about the first baby. Ryan is the first baby whose birth weight was 2.5 kg and Apgar score was 4 out of 10. Firstly, he was on CPAP for 3 days, then switched to oxygen via tent. In addition, prophylactic antibiotic therapy was given for him. Next paragraph. Although Rohan's Apgar score was 6 out of 10, which is normal, his birth weight was low, which denoted as 2 kg. Therefore, it is important to continue his radiant warmer therapy until he regains his weight. Otherwise, we can write in the initial phase, he has been treated with the radiant warmer therapy. So, no need to write it again here. He has cleft lip and palate for which he requires pediatric surgeon or pediatric surgical consultation. Next, the recommendation. Considering the above, please monitor their sucking ability and weight every day. It would be appreciated if you could render psychological support for Mrs. Michael as she is depressed owing to Rohan's condition. Next, the concluding sentence. Please do not hesitate to contact me if you have any questions regarding Ryan and Rohan. As the name of the reader is given here, you can just as yours sincerely, charge nurse. I hope it's clear for you and just try to practice in your own way. Just get the case note and try to write it. Please share these videos to your friends so they can also practice. Thank you for supporting. Thank you very much.